Hi, this is Brian Wormers recording a lecture. I'm going to be continuing on the infant and family as part of developmental influence, health promotion, special health programs for NUR 447 pediatric nursing. So as we're talking about infant and family, of course, developmental context is huge. And so infant and family has got a lot of growth at this period of time. And so that infant will develop faster at this stage than any other stage. So with that, I did make templates for you, but there are going to be some key things throughout the next couple of slides here. Part of which is how much growth in height and weight is expected the first 6 months and second months. So one big key is you take the birth weight and double it for the 6 months, and then as they hit their 1 year birthday, they'll be about 3 times their birth weight. And so that's a nice little handy trick to use, knowing that a baby that was just born will be about twice their birth weight at 6 months and about 3 times their birth weight at 1 year of age. So other things, things are starting to slow down. So you're going to see vital signs, and those changes are going to be heart rate's going to slow down, respirators are going to slow down, blood pressures are going to start going up. You're going to see that throughout the continuum here as we go from babies up until like adolescence. And so kind of put that on a grand scheme and a kind of a slide, and that will help you out understand where they should be at. If you know what a normal is for a newborn and some of these different stages in between, it will help you out tremendously for your vital signs. In real life, if you work pediatrics or working with children at all, if you have like a little cheat sheet, that's a great thing to have for a record. But other key things, maternal iron stores are depleted after 5 to 6 months. And so when they switch over from like formula to whole milk or breastfeeding to whole milk, there's no iron in whole milk. And so when they switch over, they can go through an anemic stage, and it's very, very common. 5 to 6 months is one thing. 1 year, like I said, after, so they start switching from formula to iron or to whole milk, is very common. So you'll see it probably 11 to 13 months is very, very common. Digestion's not really good. They're still working on their enzymes and making the stuff. Their liver is very immature, can't filter things out very well. Kidneys are still kind of along those lines as well. Thermal regulation, especially at birth, it's not real good. That's why they're in isolettes, and we need to keep them warm. And then their vision is developing, and so they finally get this about 4 months of age. Fine motor and gross motor, so they do a palmar so it's just kind of a natural response. Once they, so they go from just a big grass to a palmar grass to a pincer grass. Know that pincer grass, they love asking us questions on, PED certifications and different things like that. Head control, remember cephalocaudal, and so, head control by, 4 to 6 months, roll from, back to abdomen to back at 5, back to abdomen at 6, can sit up unsupported, supported at 4 months, unsupported at 7 months, and start crawling about 6 months. Can start crawling or cruising about 11 months, and then walking 12 to 15 months. These are big things and things that parents will ask you. These are also going to be on your exam, so make sure that you're studying this. So we talked about Erickson's trust versus mistrust. This video is great. You can watch it. We're not going to beat this to death here. Same with Piaget sensory motor. Realize the ages that these go with. Don't just learn the ages or the stages of Erickson and Piaget. Make sure you understand what ages of child that this will normally associate with. Social development, stranger anxiety. They don't usually like being around people that they don't know. Freaks them out a little bit. Can go up until about 2 years of age. Then usually passes. They can have some separation anxiety and realize that can be tough, especially if, like, for grandmas and grandpas. They want to love that kid so much and know them and hold them and do all those kind of things, but yet the kid doesn't really know them. And so they might kind of balk at that a little bit, and that can be heartbreaking for the grandparents and the aunts and uncles who don't know this kid as well. It's just a matter of time, getting to know them, and then moving from there. So, along with this, the nursing thing. So when you go into a room for the first time, don't just go in and attack the child. Make sure you build rapport with the parent, talk with them a little bit, give the child a little bit of time to get used to you while you're in the room. And they see that you're all right with mom and dad, then hopefully they will choose that or think that it's all right with that you're an all right person. They can trust you too. All right. So as you're learning about anticipatory guidance, think about those big changes. I mean, when they start going from transitioning from you put them down and they're still there when you come back to, oh, they're crawling, oh, they're walking, oh, they're, running and getting into things now. So think about that progression and what the parents will need to do for safety things. This is going to be including like safety gates and making sure that the outlets are covered and anything that they can hurt themselves with, things that are hot, things that are poisonous, any of those kind of things. We really do need to protect these kids from their own curiosity sometimes. So that injury protection is, a major consideration. We still think about SIDS and think about those protection things that we can use for that. So, the back to sleep movement, as well as pacifiers, as well as, keeping that crib environment clean. And what I mean by that is like you shouldn't really have stuffed animals or padded side rails or any of those kind of things. Maybe give them a blanket that's kind of thin, but we're not like giving them a great big comforter that they can smother under. Watch for choking hazards in the hospital. This might include like silly things like the caps off of some of the syringes that we use, or a cotton ball and a band-aid that we put on their finger from a stick. But kids have actually aspirated that before and choked on those before, so we really need to do a good job of cleaning out those cribs and not getting into the habit of leaving our equipment in the cribs. There's lots of different issues, and we can talk about, and we'll talk about that throughout the semester. As we move on to toddler and family, physical growth, there's still a tremendous amount of physical growth. We look at how much weight and height and length that they're getting. It's still, incredible, and I'm glad that we don't continue that throughout our adulthood. Gross and fine motor development, so walking, that's a big thing, running at 18 months. Toddlers can, up and down stairs by age 2, jump with both feet by 2.5, grasp a small item by 12 months, release it by 15 months. So those are all some key aspects of what toddlers can do for their gross motor and fine motor. Once again, I'm not going to go into details with this one, but make sure you understand, Piaget, Erikson, and what's going on with these. Gender identity, they start understanding that they're a boy or that they're a girl and what that means, and they start going into different roles. Sometimes that goes into interesting things, like if the mom is in a traditional male role and vice versa, then of course the kid might think that. Don't get me wrong, I am well beyond gender roles and who can do what and who can't do anything. But the kid might associate what they see on TV, what they hear with their friends, what they see in their family. But they're sometimes curious about, who does what roles. And they'll assign things based off of their experiences. Their language, behavior, and play development is expanding and growing. Their words are tremendous. They're starting off with simple words, of course, and then as they're developing, they explode in their language. Anticipatory guidance, once again, toilet training is one of the big things with this one. Honestly, just take your time with it. I've seen too many kids push with this, and then they have issues later on with like stool hoarding or other things like that. How do you know if your kids are ready? Some of the big things would be, can they hold their bladder and their stool for a period of time? Can they wake up from naps and they're all right? Those kind of things. They might not be able to make it the whole night. And that's fine, but maybe through a nap, and that's a good thing. If they start understanding, like a big key is little kids will often go hide behind a chair to go poop, and even though they got their diapers on and stuff like that, that might be an indication that they realize that something's going on, and maybe they can associate that with going to the potty chair. Some techniques, a variety of different techniques out there. I don't know if there's a right or wrong school of thought on this one. Some of the things that I have heard is so within the diapers, maybe put some cloth, and so when they do go to the bathroom, they can feel that and have that discomfort, because sometimes the diapers are too effective on pulling the moisture away from them, and the kids don't even realize that there's a bad thing that's going on. Put the porta potty or put the little potty by the adult potty, and then you and the child go together. This is not appropriate for nurses and your patients, but moms and dads and their kids, it's a fine thing. Do it with brothers and sisters. So if they've got older brothers and sisters, guess what? Those kids want to do everything that the brother and sister does. And so that can be a positive thing too. One of my favorite ones is like the Cheerio technique. And so if you're trying to get a little boy to pee in the toilet, float a little Cheerio in there, and that's a target for them to aim at, which I think is hilarious. So, but realize that there's lots of techniques. There's also the, keep the diaper off of them, and you watch them, and when they start to go, then you grab them and you pick them up and take them to the bathroom. And they said those people that are watching them like all the time and can be really mindful say that it takes a couple of days to do that. But my big thing is just don't push it. I've seen that go badly. Sibling rivalry and regression can happen, especially with stressful events. If they're in the hospital, their siblings might get jealous if they get toys or something like that because they're in the hospital. These kids that are in the hospital might have regression because of the stress related to it. Temper tantrums happen. They're trying to have their own autonomy. They're trying to be their own person. And so how do you deal with that? You don't want to feed into it. But also just realize that they're frustrated. And so, two main schools with that I've heard about is, one, just kind of going down to the kid's level and say that I'm sorry that you're frustrated. Can we use your words and talk about this? The other one is just kind of walking away from them necessarily, as long as they're in a safe spot. I mean, I'm not talking about leaving them at Target and you driving away in your car. But make sure that they're safe, but don't give any attention or energy into a temper tantrum. Nutrition, make sure that you're feeding them well. Sleep, they need a lot of sleep. They'll still take naps at this age. And dental health, once you start erupting teeth, most of the dentists I know will say at this point in time, yeah, come on in and let's take a look at it, just make sure everything's all right. The other thing that does is that they can establish a rapport with the dentist, and so it's not as scary if they've always kind of been going. And at this stage, they're probably not doing cleaning on the tooth that this child have, but it's probably counting them, opening up their mouth, getting them used to those kind of things. And hopefully the dentist makes it fun. As always, injury prevention, so all those safety things that we talked about before as they're moving and getting into things, as they're walking and doing those kind of things, remember that they're still top heavy and they can fall into buckets or toilets or tubs. Car safety is a paramount thing. But there's just a lot of different things that they can get into. Falls, poisoning is still a real thing at this age. So just be careful, especially as they're able to get into more things. Preschool and family. So as we're looking at this, start thinking about what does that average preschooler weigh, what's their height, what's their weight gain. Have a rough idea of that. Preschooler period. What you're going to see is that they kind of get that pot-bellied, so a big belly, and they get bow-legged with this one. So they kind of have their knees out. As they get older, then they're going to start getting knock-kneed, so their knees are more together. And then as they hopefully grow up from that, they kind of straighten their legs out. So I realize that at one point in time, bow-legged is a normal development in finding. As they get older, from preschooler, then they're going to start getting that knock-kneed, and then it should be good. And that's all based on tibial growth and things like that. So think about what you can do as gross motor, 3 months. So think about 3 years and 3 wheels, so you can do a trike and different stuff like that. Fine motor, gross motor. So if we're talking about preschool, things that they need to do for school, so can they hold a crayon? It's gross, and they're going to have some not great muscle memory and not great muscle control, but can they hold it? A pencil, even if it's the thicker ones or the markers or stuff like that. Can they start using scissors, as they get older? So remember Piaget's, Erickson's, those kind of things. Believe that their words can have magical properties with this one. That if they say something might happen, and it happens. An example of this would be like, I wish something bad had happened to my brother because he took my toy, and then the brother gets hospitalized. This preschooler feels really bad about that, thinking that they caused it. And so realize that that can happen, and that's an important thing for nurses to understand and realize within that family dynamic of caring for the hospitalized children. So with moral development, this is probably just they're starting to get an understanding that other people have feelings and that what you do might impact the way, other people's feelings, and starting to have an outside view of their world a little bit. It's not just always me, me, me. In preschool years, see sex typing, so kids might associate different jobs with different characteristics. This is what guys do, this is what girls do, and just kind of help them along with this. I'm not saying that any role is assigned to any gender by any means, but think about where the kids are, what they see, what their baseline is, and so you can get some anticipatory guidance with sexuality with the parents. Along this line too, we can also start talking about private parts, who gets to see them, who gets to touch them, who gets to do those kind of things, and start having those conversations. Behavior and play, this is how they grow, this is how they develop, this is how they learn in their world. There are some sources of fear for preschoolers. Tends to be they're curious about their genitals, and they're afraid that they might fall off or that they might hurt them or those kind of things. Aggression in a child is kind of normal as we're talking about toddlers and maybe even preschoolers, because they just don't have the words and the vocabulary to say, oh, when you took my toy, it really made me upset this, and I felt that you're very inconsiderate to my feelings on this. They're not going to say that. They don't have the linguistic skills available for that. And so along with that, they often get aggressive. They hit, they bite, they do those kind of things, and that's just their way of trying to deal with that situation. A common speech problem with this is going to be stuttering, and so realize that stuttering is common. If we accent it a lot, if we try to intervene with this or yell at them to stop stuttering, it usually creates more stress and makes the stuttering worse. And so I have seen that with parents, especially dad, where dad will yell at the kid to stop stuttering. The kid stutters more because he's really nervous, and while he wants to obligate his dad and obey, he's unable to. It's not something that he chooses to do, and the more you stress out about it, the worse it tends to get. So anticipatory guidance for preschoolers, nutrition is great. Get them open to a lot of different foods and veggies and stuff like that. Just like sometimes with the infants, sometimes you have to offer the veggies before you do the fun stuff, and like the fruits. Nighttime rituals are great. They'll often try and propose sleeping for another drink of water or another story or those kind of things. So make sure you set up some boundaries with that one. Another drink of water can also backfire too if they've got enuresis or bedwetting, so be careful with that. Dentation. So as they're going on, just kind of watch the teeth. Maybe a little bit early for them to start losing teeth at the preschooler age, but some might. You're going to see that more kindergarten, first grade level, even throughout elementary school. Injury prevention, so MVAs, accidents are major leading causes of death. And so we really do want to try and keep them safe as they're, riding bikes and, skateboards and doing stuff like that. So helmet prevention is key, as well as, trying to keep them out of the streets and do those kind of things. Infectious disease, so if this kid has always been with the family and has never been outside of that environment, going to school can be a big taxing thing on their immune function. So they're around a lot of different people that have a lot of different backgrounds, and that first, preschool and kindergarten, if they haven't been to daycare a lot or whatever, they might have more colds and flus and infections than ever before in their life. Chickenpox, while this is an infectious disease, a lot of the testing likes to test on chickenpox. We do have immunizations now, so most of the kids don't get it. But they like to test it because it is an airborne disease. So realize with that, we have to have the negative airflow rooms, we have to have the PAPRs or the N95 masks, and we have to be careful with that because it is highly contagious. School age, physical growth and development, they're still growing. They still can grow between 1 and 4 inches every year. When you get rid of the booster seat, so look at the guidelines here, but also realize that South Dakota law is different. South Dakota law is much more lax than what the AAP, or the American Academy of Pediatrics will recommend. That being said, I side with the AAP on this one. I want to keep kids safe, and I've seen too much trauma. And so, yes, my kids hate that about me. But yes, I did keep Alexa in a car seat until she was 4'9" and all that kind of stuff. And she kind of hated the booster, but I just didn't want her to get hurt from that. Prepubescence. And so as they get later stages, they start getting some of the changes, but we'll talk about that more in adolescence. So know your Erickson's, Piaget's, Kohlberg at these stages and ages. They're going to start developing more independence from their parents. Peers are becoming more and more important. They start developing their own self-concept and what they want to look like and who they want to be. Anticipatory guidance, so talking about school, keeping them in school, what are they going to do after school for safe care. This could be, latchkey kids with appropriate resources to child care programs, home care, to sports, to going to the library. I've heard a whole bunch of things, but we just have to make sure that these kids are safe after school. Limit setting, especially with like electronics and those kind of things. If we have to punish them for bad behavior or something, taking away privileges is often very effective with this one. Way more than like physical punishment or any of those type of things. Sources of stress at this age, of course, what their peers are doing, how school is. I mean, it's industry versus inferiority and all those kind of fun things. Nutrition, make sure that they get food, and what are they choosing to eat. Of course, they want Doritos and pop and different stuff like that, but make sure that we're limiting some of that. Sleep and activity, make sure that they're getting enough sleep, make sure that they're still getting enough physical activity. You know all these things. Sports safety, so following the rules, having appropriate attire, helmets, those kind of things. Dental health, they should be having dental visits twice a year, fluoride treatments, and doing that dental health appropriately. Developmentally, sex ed, so start talking about those things. They might start getting curious about it. Start calling your private parts, by appropriate terms, so they understand, like, this is a penis, this is a vagina, these are the appropriate terms for these things. School refusal, this could be from a lot of different things. It could be just that they enjoy hanging out at home, their parents are fun, or they've got all their stuff at home, and school is less exciting. It could be that they're getting bullied, it could be from a whole host of reasons, but it is kind of important to get down to that core root of, why. Ask them and get some understanding for why they don't want to go to school. But realize it is common at this age. So we can talk about adolescence and family right now with physical growth, puberty. Girls will develop faster than boys, but you can click here for what those growth parameters are. Growing hair, breast development, those kind of things. Struggle with acne related to hormonal changes. Also probably they may or may not have great skincare methods. Body odor as part of the changes to sebaceous sweat glands and those kind of things. Once again, Erickson's, they're starting to get more adept, and they're starting to, their peer group is really important with them. They want to start developing their own personality with this one. They're starting to pull away from family members. They're still starting to learn their role and identity with sex and what does that all mean. And, we flood them with all this propaganda with ads and TV and stuff like that about, what sex is and what sexual identity is and all those kind of things. And that can be really hard at this age. Also think about puberty and how that impacts their self-concept. At this age, teenagers really want to be just like their friends. So if they develop faster or slower, that's really hard on them, because then that makes them different than their peers. Also, of course, there's those awkward things where you get the voice changes and, it's just, periods and all those kind of fun things that they have to learn how to deal with and work with. So, going into Piaget's formal operations, realize that they're developing this. as they're talking about Kohlberg development and what's right and wrong, and they're starting to change those things. But just realize that they're adapting. As they're growing up, they're getting smarter, but they also will vacillate a little bit, oscillate a little bit between acting like an adult and acting like a kid. And that's just part of their development, and that's been well documented on MRI. And so that's just a normal part of this. So anticipatory guidance with this, immunizations, especially when they start hitting the teenage years, when we start talking about lots of different vaccines that they should be getting. Nutrition is still a big thing as we're trying to promote healthy nutrition and not just Doritos and a can of Coke for lunch. Sleep, exercise, activity, dental health, all this stuff is really important. Dental health gets kind of interesting with school agers and puberty, especially as we're talking about braces and those kind of things, and how that might make them the same or different than their peers. I've known some kids that wish they had braces because all their friends had braces. So just realize that they don't like being different than their peers. Personal care is starting to do more of the personal care, which they might lack on. But realize that, we're starting to talk about, the deodorant and the antiperspirant and all those self-care behaviors. Stress reduction. Suicide is still a major cause of death at this age group, unfortunately. And a lot of it's related to stress. Stress for fitting in with their friends. Stress for doing well on sports or school or trying to make parents proud or make themselves proud. Maybe they're a very type A personality. So suicide is a major risk factor at this age group, and we have to be talking about it with them. We have to try and prevent it. We have to minimize this as much as possible. Relationships with them within their friend groups, as well as with boyfriends, girlfriends, those kind of things. Injury prevention, need to talk about that. They're starting to drive. They're starting to do things like that. Around guns, around alcohol, drugs, those kind of things. Sexuality is a concern. Substance abuse is a concern, just like I said. A good way to talk about these kind of things, of course we don't want to do that with a caregiver in the room or anyone that they value in the room, so you're going to get better results if you ask them in private. Another trick that I've learned with this is that you can also ask them about their friends. And that's not the same as what they will do necessarily. I get that, but it might be a jumping point that, if your friends are doing this stuff, you can talk to them, well, are they doing it? And they might be honest, they might lie, who knows. But sometimes you can get a view into their world because it's less prying for you to ask about their friends than it is for you to ask about them. Alright, this concludes this lecture. If you have any questions on it, please contact me.